Hi, I'm Dr. Alina, a dermatologist and dermatopathologist at the Mayo Clinic, and I'm here to talk about psoriasis and our psoriasis specialty clinic today. Psoriasis is a common chronic inflammatory disease of the immune system that typically involves the scalp, elbows, knees, hands, and feet. However, any part of the body can be involved, and it can involve the nails, mouth, and joints. 40% of patients with psoriasis experience joint inflammation called psoriatic arthritis. Psoriasis is a serious medical condition. It affects approximately 7.5 million people in the United States. Psoriasis affects people in all age groups and affects men and women equally. The cause of psoriasis is not clear. However, we know that there are familial cases of psoriasis, and approximately 80% of people with psoriasis have relatives with the disorder. We also know that several factors can trigger a flare of psoriasis. These include an infection, stress, certain drugs such as blood pressure medications and oral steroids, as well as trauma. How do we diagnose psoriasis? A diagnosis of psoriasis is made by skin examination. Sometimes a skin biopsy is necessary to help make the diagnosis. In psoriasis, patients typically have raised red skin lesions covered by white scale. These areas can itch. Most people have mild disease that affects only a small part of their body, but some people with psoriasis can have more extensive involvement that covers over 50% to even their entire body surface area. Other diseases and conditions can be associated with psoriasis, including diabetes, heart disease, and obesity. Inflammatory bowel disease is 3 to 7 times greater in psoriasis patients compared to the general population. Psoriasis can have a significant psychological and emotional impact on patients. Depression is more common in psoriasis patients. Smoking and alcohol use are also more common in psoriasis patients. How do we treat psoriasis? In patients who have mild disease, we just need to use various topical treatments that include topical steroids, tar, salicylic acid, and topical vitamin A and D preparations. Patients who have more moderate or severe disease, as well as patients with joint disease, require topical treatments in combination with light therapy, oral medications, or biologic medications. Biologics are taken by injection or infusion. Retinoids, cyclosporin, methotrexate, and Otezla are taken orally. These medications require testing before starting the treatment and periodic monitoring and evaluation. Light therapy is administered as an outpatient and includes a 21-day Geckerman treatment, narrow-band ultraviolet B 3 times a week, broadband ultraviolet B 5 times a week, or PUVA 3 times a week. Our psoriasis specialty clinic is where you need to come for evaluation and treatment of your psoriasis. We offer a multi-specialty, patient-centered approach to your care. At the Mayo Clinic, you will receive unsurpassed care by experienced providers. We have had one of the longest experiences in the management of psoriasis. This goes back to the time almost 100 years ago when Dr. Geckerman was here at the Mayo Clinic, and we continue to use his Geckerman's tar and light therapy for 21 days as an outpatient, and have found this to be one of the most effective and safest treatments available for psoriasis. We will evaluate you, and based on the type of psoriasis and the extent of your psoriasis, as well as your prior treatments and other medical problems that you may have, determine which treatments would be the most appropriate for you to receive to get your disease under control. We will also coordinate appointments for you in rheumatology for joint disease, gastroenterology for inflammatory bowel disease, endocrinology for diabetes and weight problems, and internal medicine for heart disease. We can also assist in smoking cessation, alcohol rehabilitation, and stress management during your visit. You can enroll in our wellness program for weight loss and exercise. You may also be able to participate in research studies. Our goal is for you to have the best possible experience and receive coordinated and efficient total care so that all aspects related to your psoriasis can be successfully managed.